We have two papers, and we have time for a conversation afterwards. And so the first speaker is Anya King, who is now an associate professor of history at the University of Southern Indiana. And so she has a double major for her PhD in Central Eurasian Studies and Near Eastern Languages. And she has published a certain number of things which are totally relevant for our conference now, including Ibn al-Jazar on smell, perfume, and health, and something that you'll understand I am interested in, musk, dear musk, and perfume. And so, without further ado, I'll give the microphone to Anya.
And thanks to the organizers for inviting me to this wonderful conference. I've learned so much. Here's my talk. In the classical Islamic Middle East, there was a well-established etiquette of dining. Perhaps the most detailed account is found in the very literary cookbook of Ibn Sayyar al-Warraq from the second half of the 10th century, a book we've mentioned several times in this conference up until now. While this work includes recipes, it is also a guide to good dining and its practice. Al-Warraq delights in spicing his cookbook with anecdotes and poetry, unlike other extant cookbooks, which are basically collections of recipes. A guest at a fine dinner would groom and perfume carefully beforehand. Once seated for the meal, hands were rinsed with water and, in some fancy cases, rose water. Eating was done with the hands and fingers from communal bowls. After dining, an elaborate process of cleansing the hands and face was observed, and it is in this context that Ḥunayn, the subject of today's presentation, appears. In al-Warraq's account of the refined gentleman's procedure, different stages of cleaning and perfuming involved different compounds, but at the most basic level, Ḥunayn served as the soap that cleansed the grease and grime of dinner before being rinsed away. Then drying with a napkin and perfuming might occur. Before we proceed to our subject, we must emphasize one central point. This process of cleansing was done at the site of the meal, communally, ideally with the assistance of servants who would distribute the materials and equipment, rinse the hands with water, and remove the basin of dirty water. All of the components of this process were visible to the participants in the meal, who would scrutinize their quality and, ideally, find occasion to praise their host's decorum and taste. This is an important factor in the effort lavished on creating the Ḥunayn compounds we will discuss today. At its most basic level, Ḥunayn is a cleanser made with saltwort. Certain plants thrive in salty environments and accumulate alkali salts such as sodium carbonate and potassium carbonate in their tissues. These plants include the Salsola kali of the Middle East and other species of Salsola, the saltworts or glassworts. They may be burned for their rich ash full of useful salts of potassium carbonate and sodium carbonate. In medieval Arabic, the saltwort plant is termed Ḥunayn, as is the ashen product of its combustion in our formulas, and also the dining table compound that is based upon the saltwort ashes. The saltwort ashes combined with oils and grease to form a kind of soap. Thus, rubbing the hands with Ḥunayn facilitated the degreasing and cleansing of the hands of the diners. In what follows, we'll translate the ingredient Ḥunayn in the formulas as saltwort, but retain the name Ḥunayn for the resulting compound. And this is also called kili or kali in Arabic, from which we get the word alkaline, but that term is never used in these perfume formulas that we're going to discuss today. Ḥunayn was not used in the time of Muhammad. The great Islamic scholar al-Ghazali, 1058 to 1111, regards its advent as beneficial and useful innovation, helping to secure its acceptability from the religious point of view. Al-Ghazali's recommendations for table etiquette include the use of Ḥunayn as a cleanser, reflecting centuries of practice by his lifetime. The first attested Ḥunayn compounds flourished around the turn of the 9th century and are associated with the court of the Abbasid Caliph Harun al-Rashid. A formula purporting to be for Harun al-Rashid's Ḥunayn is preserved by al-Warraq in the 10th century. And preparation for the Ḥunayn for Harun al-Rashid One takes 1 part each of cloves, cassia, canela, cardamom, and phalangia, 1 part mastic, camel grass, cyperus, dry storax, 3 parts of marjoram, 5 of white Meccan clay, double or triple the total of bariki saltwort, and an amount comparable to the saltwort of moistened, dried, and sieved white rice. Grind each part separately and then mix. Meccan clay appears in no other perfume formula, but clay appears elsewhere in Ushnan formulas, including Al-Waraq's 2 other formulas. The proportion of aromatic ingredients in this formula is small compared with the saltwort itself, double or triple the total. 16 parts of aromatics in clay to double or triple worth of saltwort yields 32 or 48 parts of saltwort, then 32 or 48 parts of rice. Formula offered by At-Tamimi after the 10th century Muhammad bin al-Abbas al-Khushki contains Bariki Ushnan, Barik being a place in southern Iraq known for its saltwort, so it's a famous saltwort source. 2 Ushnan formulas are preserved in the Firdaus al-Hikmah 850 of At-Tabari in the first Arabic medical compendium. One of them is attributed to the famous associate of Harun al-Rashid, Yahya bin Khalid al-Barmaki. And here's the formula. It's described as benefiting the teeth and strengthening them, so it's going to be used in the mouth as well as on the face and hands. And it's a mixture of cloves, spikenard, peeled melon seeds, canela, sandalwood, camel grass, good dry storax, cyperus, cubebs, saltwort, 3 parts worth, and Indian aloes wood, white flour, husked beans, ground husked chickpeas, and then the saltwort is ground and mixed with it together with oil or camphor water to cool it. Then one grinds the ingredients, finally mixes them together, and uses it. End of the passage. This formula is contained in a book less than 50 years after the death of its alleged author in 805, and certainly reflects early Ushnan manufacture. The ingredients are common in Ushnan formulas in general. Its composition is 11 parts aromatics, 3 parts saltwort, and 1 part fillers, thus 25% saltwort. The combination of the saltwort and the oil within the compound would have produced some soap-like qualities within the mixture even before being applied to greasy hands. I'm not going to deal with At-Tabari's second formula for Ushnan. It's got some problems in it, in very poor edition of this text that's available, but I want to mention one thing about his second Ushnan formula, and that is the presence of mahlab. Aromatic mahlab, the kernel of Bunus mahalab, straddles the categories of base and aromatic in the Ushnan formulas. The fatty kernel of the mahlab nut would evidently react with the saltwort to produce some soap within the compound. Several Ushnan formulas include mahlab and or an oil, meaning they were ready to cleanse grease to some extent even before application to a soiled hand. Others did not, and correspond more closely to Charles Perry's memorable characterization of Ushnan as essentially a laundry powder containing expensive perfumes. One notable early type of Ushnan is called Hamduni Ushnan. This name appears to be derived from the name of Rashid's daughter, Hamduna bint Ghadid. The first formulas explicitly described as Hamduni Ushnan, however, appear much later in At-Tamimi's Tib al-Arus from the late 10th century. At-Tamimi claims both of his formulas as his own work. The first is based on saltwort, rice, and many aromatic ingredients, some characteristic of At-Tamimi's work, but not commonly used in other perfume formulas. And the second of these is a white perfumed Ushnan, also from those I compiled according to the method of the Hamduni. End of quote. It's also based on saltwort, rice, and aromatic ingredients. At-Tamimi's collection includes an appended formula that claims to describe the Ushnan that the Abbasid Caliph al-Ma'mun, reigned 813 to 833, used for hand washing. According to At-Tamimi, he got it from one Ibn al-Bawab, who is otherwise unknown. It is that one takes 1 man of white, clean Persian Ushnan, known as sparrows, safiri, half a man of dried rind of Khurasani melon, a quarter man of sieved shelled sweet almonds, an ukiya of milled ma'i saffron, 2 ukiyas of clove blossoms, mill together in sieve, knead with rose water and spread out in cups, sense with Indian aloes wood, fine nad, and camphor continuously until it dries. Finish its drying in the shade, then grind, sieve with Chinese silk, sense albarellos for it, and put it up. End of quotation. If we accept the chronology of the early Ushnan formulas presented down to this point, this is the first instance of the famous asafiri saltwort. This term asafir means sparrows, and the explanation of this term is that the white Ushnan resembles the white droppings of sparrows. Al-Biruni reports of saltwort, quote, "The most gentle of it is what resembles the excrement of sparrows," end of quote. Gentleness is certainly a desirable attribute for Ushnan because the effect of Ushnan containing lots of saltwort must have been rather like cleansing with lye soap or indeed laundry powder. Al-Ma'mun's Ushnan's sparrow's saltwort is furthermore described as Persian. High-quality Ushnan is described as Persian elsewhere in At-Tamimi's formulas. The word Ushnan is a Persian loanword in Arabic, and Ad-Dinawari, the 9th century authority on the philology of plant names in Arabic, defines Ushnan as Hurud, giving its authentic Arabic name. We have seen that one of the very oldest formulas for Ushnan is credited to a Barmakid, one of a family of Eastern Iranic origin, further bringing the table culture of using Ushnan into the Iranic sphere. The term for the vessel that contained the Ushnan at the table also bore the Persian name Ushnandan. And the Caliph al-Ma'mun is well known for his time spent in the city of Marv in Khorasan, from which he ruled as caliph from the beginning of his reign from 813 to 819, when he returned to Baghdad. His formula fittingly includes Khorasani melon, an exemplary type that also appears in another of At-Tamimi's formulas, in which he describes how to take and dry its rind for making Ushnan. Other ingredients of this formula are characteristic of Iran and the East: the almonds, saffron, rosewater, plus the aromatics from even further in the East, such as cloves, aloes wood, and camphor. Ingredients like marjoram, cyperus, oak moss, and apple, so common in other formulas, are absent. These 4 formulas, then, are the candidates for the earliest Ushnan procedures. The remaining formulas we will consider come from Ibn al-Jazar, died 879 or 80, and Zahrawi died about 1013, and he's copying most of his formulas from Ibn al-Jazar anyway, and Tamimi himself. The chapter on Ushnan in Ibn al-Jazar's book on perfumery contains 7 formulas, because his formulas do not include any saltwort at all, and they would have had no cleansing properties beyond the capacity of some of the base ingredients to soak up grease. A notable exception is a single formula called a ghisl or wash, and not an Ushnan, though it is included in the chapter on Ushnan. This formula includes natron. He states that it cleanses the hands and dispels stench. Quote, "One takes 4 mithkals of cloves, an ukiah of natron, 3 ukiyahs of small beans, crush them together carefully and use it. It is beneficial and good." End of quote. Alkaline natron would saponify grease, and thus this formula is a candidate for an effective cleanser. This formula is also copied by al-Zahrawi, and it's the only formula in his collection of Ushnan formulas to include an active ingredient as well. This formula also has the distinction of being the single formula for a cleansing compound in all of the collections to contain natron. It may be that Ibn al-Jazar, working in what is today Tunisia, simply had better access to natron than to saltwort. But it's interesting to note that At-Tamimi, who worked in Egypt, does include saltwort in his Ushnan formulas, but never natron. Ibn al-Jazar's formulas have a variety of bases: melon, rind, and flesh, the musk compound, suk, Armenian clay, barley, lentils, beans, and apple peels. Some are about as remote from the white or pale-colored Ushnan idealized in the earlier formulas as imaginable. His first formula is based on suk and 12 aromatic ingredients, suk itself being based on dark-colored gall nuts scented with musk, and thus this compound would have a blackish color. Yet he describes it as a, quote, "refined Ushnan, which I prepared for the nobles to wash their hands with. It perfumes their scent, benefits the gums and mouth, and removes the lingering scents of many foods," end of quote. Thus, this was really a scented paste. It contained no oils, but the suk and rosewater would have made it spreadable. His second formula similarly contains suk and melon rind, although its chief ingredient is musk. He says that this one's better than the first one, and it was prepared for a Fatimid prince. All of Ibn al-Jazar's formulas emphasize aromatic ingredients more than bases or indeed cleansing agents. The aromatics are quite varied, including many of the major Islamicate aromatics in one or another formula at least: aloes wood, camel grass, camphor, canela, cardamom, citron, cloves, cubeb, cyperus, mace, marjoram, musk, myrtle, etc. Zahrawi includes 6 formulas for Ḥunayn, 4 dependent on Ibn al-Jazar. One has a unique base of vetch seed, the other a base of beans. I'm not going to go into these in the interests of time, except to say that, again, they don't contain any saltwort. At-Tamimi's formula, on the other hand, contains mostly formulas that include saltwort. Some that he quoted from earlier authorities we've already encountered. In general, the aromatic ingredients that he calls for are similar to those of Ibn al-Jazar and al-Zahrawi. As mentioned above, At-Tamimi also includes a formula from At-Tabari that's quite different from either of the formulas in the published edition of his work. Actually, I didn't mention it before, I cut it for time. Unlike At-Tabari's 2 formulas, the saltwort is specified as sparrow's saltwort. At-Tamimi quotes 2 formulas from Muhammad bin al-Abbas al-Khushki based on rice with various aromatics. The first of them is based on rice, mahlab, and other aromatics, but includes no saltwort, and At-Tamimi comments, quote, "It is necessary to add to it the equivalent measure of its ingredients of milled Persian saltwort," end of quote. This raises an important question. Was the formula complete in Ibn Abbas' version, but deficient in At-Tamimi's eyes because it lacked the saltwort? Or did Ibn Abbas simply assume that the reader would know to add saltwort? The second one quoted from Ibn al-Abbas likewise includes no saltwort, but At-Tamimi doesn't comment on adding saltwort to it. Nevertheless, in every other formula, At-Tamimi includes saltwort, mentioning specific types, quantities, and preparations. Al-Warraq, writing in the second half of the 10th century, has 3 Ḥunayn formulas, including the one for Harun al-Rashid's Ḥunayn mentioned above. The other 2 are fairly simple, prepared according to formulas that we've been discussing in the paper. Indeed, both are described as inferior to al-Rashid's Ḥunayn, based on saltwort and white clay and admixed with aromatics. The first calls for camel grass, cyperus, and sandalwood, while the second omits the sandalwood. Both are mixed with camphor water, and given al-Warraq's origin, these formulas likely reflect Ḥunayn practice in Iraq. To conclude, we have seen great diversity in these Ḥunayn formulas. Some contain alkaline saltwort to saponify grease upon a messy diner's hands and face. Some contain, along with the saltwort, a fatty substance, which would make them a sort of soap powder. Some appear to contain no active ingredient at all. What they have in common is the prominent role of aromatics. As much care and effort went into these formulas as into formulas for other varieties of perfumes and Islamicate formulas. The essential function of an Ḥunayn was to cleanse hands, face, and mouth at a meal, if not by actual cleansing, then by soaking up and diffusing as much grease and grime as possible. But they became one more part of the repertory of perfumes for the refined life. For a meal in which guests were present, the Ḥunayn became one of the components of a feast whereby a host could show his good taste and solicitude for his company. Thank you.
Thank you, Anya, for sticking so closely to the time. We appreciate that enormously. And without spending time now, we'll move immediately to the second paper. She's a doctor of Greco-Arabic Studies from the University of Ioannina in Greece, and she's been teaching Greco-Arabic studies, not only in Ioannina, but also in other structures. And most interesting for us, she has published on the question of the interrelationship between Byzantium, the Greek-speaking world, and the Arabic world, about philosophy, historical text, Alexander the Great, for example. And she will talk now about Ḥunayn ibn Isḥāq and the translation of Greek medicine into Arabic. And we are very interested in knowing more about that, just as we were about the Ḥunayn and the rituals of banquet. So, Theodora, the floor is yours.
Thank you, Professor Touwaide, for the generous presentation. I would like to express my deep gratitude to the organizing committee for inviting me to present my paper. The Islamic Golden Age marked a period of unprecedented intellectual activity in the Islamic world. During the Greco-Arabic translation movement that has taken place from the 8th to the 10th century onwards, almost all non-literary and non-historical secular Greek books, such as scientific, philosophical, and medical texts, were rendered into Arabic. This movement centered in the Abbasid capital of Baghdad, laying the foundation for the development of a distinctly Islamic intellectual tradition. Among the most distinguished figures in this movement was Ḥunayn bin Isḥāq, an historian, Christian polymath, physician, and translator, whose contributions to medicine were pivotal in shaping the course of scientific discourse in the Islamic world. Ḥunayn's extraordinary linguistic ability, he was fluent in Syriac, Arabic, and Greek, enabled him to consult multiple Greek manuscripts, compare versions, and produce highly accurate and readable Arabic translations. Ḥunayn's role as a translator and medical theorist went beyond the mechanical rendering of Greek texts into Arabic. Ḥunayn's translations were marked by a critical approach based on a full understanding of both the source and target languages, as well as of the subject matter. His project was not only linguistic but intellectual. He sought to reconcile Hellenistic medical science, especially that of Galen and Hippocrates, with the emerging epistemological frameworks of Islamic thought. His ability to communicate complex ideas across languages and cultures earned him the title Shaykh al-Mutarjimin, that means the master of translators. In this fertile intellectual context, Ḥunayn composed a handbook entitled Al-Masail fil Tibb lil-Mutalimin, that means questions on medicine for students, not only as a teaching tool but as a distillation of Greek medical logic, rearticulated for the needs of the Muslim audience. His blending of science with ethical instruction mirrored broader developments in Islamic adab literature and demonstrated how medical knowledge could be harmonized with moral and religious values. The result was a uniquely Islamic form of medicine that drew on classical learning while aligning itself with the goals of piety, social welfare, and rational inquiry. Al-Masail fil Tibb lil-Mutalimin stands out as a pedagogical text designed to introduce students to the fundamentals of medicine in a clear, accessible, and ethically grounded manner. This book was one of the most widely read medical books in Islam. The writing of the questions started in Baghdad under the Caliph al-Mutawakkil, and Ḥunayn set it in questions and answers on the model of Galen's Ars Parva. It provided a short handbook of Hellenic teachings, an introduction to medicine that achieved the greatest success for generations and that formed the basis on which candidates to the practicing license were examined when this became compulsory in Baghdad. Written primarily for students, as its name implies, it offered an introduction manhal to the study of medicine and pharmacology. In fact, it was sometimes called introduction, which led many authors to suppose that the questions and the introduction were different works. In fact, it is recognized that the questions did more to define later medicine than any other text. Composed in the form of a dialogue, the work is structured as a series of 36 questions and answers addressing foundational medical concepts, diagnostic procedures, and moral responsibilities of the physician. This format, reminiscent of the Socratic method, was particularly effective for introductory medical education, making the text accessible to beginners. The choice of the question-answer format itself reflects a conscious pedagogical strategy. Ḥunayn adopted a method that encourages active learning and internalization of knowledge. The student is not a passive recipient, but an interlocutor whose inquiries guide the progression of the text. This format also mirrors the oral teaching traditions of both Greek philosophical schools and Islamic religious madrasas, suggesting a fusion of intellectual cultures. The structure reflects Ḥunayn's broader vision of medicine, not merely as a technical science, but as a moral vocation requiring ethical deliberation. Ḥunayn sought to produce not only skilled practitioners, but also morally upright physicians for whom the welfare of the patient was paramount. The purpose of the work is twofold. First, to convey basic medical knowledge in an orderly and logical manner, and second, to cultivate the character of the aspiring physician. The work begins with a question concerning the divisions of medicine, to which Ḥunayn replies by dividing it into theory and practice, a division that parallels the modern classification of science into pure and applied. Theory, in Ḥunayn's view, is speculation on natural things, indeed the universals, like the elements, temperaments, humors, organs, forces, actions, and spirits. Each of these 7 then branches into divisions, and speculation includes causes and signs. The first sections deal with general questions. Of these, the first is concerned with universals, the second with the theory of disease, genera of disease, and stage of the body, the third with causes, genera and species, the fourth with signs, genera and species, the fifth with treatment, and the sixth with drugs, kinds, forces, and ways. Subsequent questions introduce major theoretical principles, such as the 4 humors, the qualities of the elements, and the natural faculties of the body. For instance, in response to a query on the nature of the humors, Ḥunayn explains the salty, which is the hottest and driest kind, the sweet that tends to be hot and wet, the acid that inclines to be cold and dry, the one that resembles molten glass, which is the coldest, wettest, and thickest kind, the kind that has no taste and is purely cold and wet and is called tasteless, i.e. insipid. This humoral theory formed the backbone of Greek medicine and was fundamental to diagnosis and treatment. The work also emphasizes observation and reasoned judgment, presenting medicine as both empirical and rational. In one passage, Ḥunayn cautions students not to rely on superstition or unfounded remedies. The opinion held by empiricists is not correct because the compounding of drugs cannot be achieved without logical thinking, but only by logical thinking. This statement reflects his Hellenic rationalism. Ethically, Al-Masail goes beyond technical instruction. Several questions deal with the physician's moral obligations. For example, when asked whether a physician judges from the period of the disease, Ḥunayn answers, if the illness is in its beginning, and if it is acute, this indicates the necessity of gently managing the patient. If it is chronic, management should be heavy. If the illness is at its end, we must necessarily manage the patient with gentleness. And if the illness has abated, this indicates managing the patient like a convalescent. This anticipates the later elaboration of Islamic medical ethics, Adab at-Tabib, as found in works like Isḥāq bin Ali al-Ruhawi's Adab at-Tabib, Ethics of the Physician. Ḥunayn's methodology in both his translations and original writings, including Al-Masail, demonstrates a remarkable commitment to precision, pedagogical clarity, and epistemological coherence. His method was not limited to the literal transmission of Greek texts, but involved a deeply reflective process of interpretation, adaptation, and systematization. This intellectual rigor, shaped by both Greek and Syriac scholarly traditions, earned him the reputation of being the most authoritative medical translator and educator of the Islamic Golden Age. Ḥunayn's method, which starts with the universals and then goes on to diseases, their causes, and their signs, before moving on to treatment, proceeds from the universal to the particular in a way typical of the philosophy of science of his time, that aimed at reaching the essence of disease, of its cause, and of its treatment. For in this logic, the essence of everything is permanent and universal. Ḥunayn's translation philosophy was characterized semantic rather than literal approach. Ḥunayn established the critical philological method for Greco-Arabic translation, a method that involves comparing various Greek manuscripts, understanding context, and translating meaning over literalism. In Al-Masail, Ḥunayn's intellectual rigor is evident in his systematic arrangement of topics. He begins with definitions, followed by theorisms, then diagnostic procedures. This sequence mirrors the Aristotelian model of scientific knowledge, which begins with definitions and proceeds through logical deduction, a model adapted by Galen and later elaborated in Arabic by philosophers like Al-Farabi and Ibn Sina. Each question in Al-Masail is not only answered but often contextualized within a broader conceptual framework, reflecting an understanding that medicine is both a practical and theoretical science. For instance, when asked about the causes of fever, Ḥunayn does not merely list symptoms but delves into the physiological basis of heat, the interaction of humors, and environmental factors. His methodology thus integrates empirical observation with theoretical reasoning, reinforcing that Galenic ideal of medicine as an art, the Greek term techni, grounded in rational inquiry. Ḥunayn's choice of a question and answer format in Al-Masail is also a methodological decision grounded in pedagogical theory. This format, influenced by Galenic didactic works and possibly by Syriac scholastic traditions, serves to engage the student directly, fostering active learning and internalization. Each question represents a logical step in the acquisition of medical knowledge, with answers designed to be concise yet conceptually rich. Ḥunayn was not an uncritical transmitter of Greek science. In Al-Masail, he shows willingness to evaluate, correct, or adapt his sources. In some cases, he harmonizes contradictions between the Galenic and Hippocratic texts. In others, he adjusts technical terms to fit the Arabic language's conceptual structure. This reflects an epistemic humility and rational criticism, hallmarks of classical Islamic scientific thought. The intellectual framework of Al-Masail is deeply rooted in the classical Greek medical tradition, particularly the works of Hippocrates and Galen. Ḥunayn did not simply inherit this tradition. He actively shaped its transmission and reception in the Islamic world through his translations, summaries, and original compositions. His work represents a fusion of Greek medical epistemology and Islamic ethical rationalism, contributing to the emergence of an Islamic canon of medicine. Of the two Greek authorities, Galen of Pergamon had the most enduring influence on Ḥunayn. Galen's vast medical corpus, covering anatomy, physiology, pathology, pharmacology, and ethics, formed the backbone of Islamic medical education. Ḥunayn is known to have translated over 129 works attributed to Galen, more than any other scholar of his time. In Al-Masail, Galenic influence is clear in both terminology and methodology. The four-element theory, earth, air, fire, water, and the humoral system, blood, flame, yellow bile, black bile, are all adapted from Galenic writings. For instance, where Ḥunayn explains the composition of the body and the nature of disease, he follows Galen's on the elements according to Hippocrates, stating that illness arises when the balance of the humors is disrupted. Ḥunayn's didactic tone and logical structure also reflect Galen's pedagogical principles. Galen emphasized that the physician must first study logic, then natural philosophy before undertaking the study of medicine, a sequence echoed by Ḥunayn's emphasis on methodical reasoning. Logic deduces the composition of a drug. while experiment tests the virtues of compound medicines as deduced by logic. Though Galen dominated the medical curriculum, Hippocrates, the so-called father of medicine, remained a revered authority, especially for his clinical insights and ethical ideas. Ḥunayn translated several Hippocratic works, including the aphorisms on regimen in acute diseases and prognostics, either directly from Greek or via Syriac. The influence of Hippocratic ethics can be felt in the moral tone of Al-Masai, especially in the emphasis of the physician's duty of care, humility, and avoidance of harm. Moreover, Hippocratic focus on prognosis and clinical observation appears in Ḥunayn's emphasis on sensory data, sight, touch, and even smell as diagnostic tools. In line with Hippocratic teachings, Ḥunayn notes to the patient their symptoms and to the physician their signs. This empirical grounding balanced the theoretical system of Galen and rendered the text highly practical. Ḥunayn's book Al-Masail is not only a systematic introduction to medical theory and practice, but also a deeply moral document. The most recurrent ethical motive in Al-Masai is the injunction against harm. Echoing the Hippocratic maxim primum non nocere, first do no harm, Ḥunayn states, they, the dogmatists, also know the reason why each of these compound drugs is useful or harmful. This cautious and humble approach to medical intervention reflects not only Greek traditions but also ethical norms. In cases of uncertainty, Ḥunayn advises restraint, arguing that the physician should avoid unnecessary experimentation on the patient. The better way is to use medicines tested by experience after learning their mode of use. This reflects an ethical empiricism grounded in both responsibility and rational verification, a principle also supported by Galen on medical experience, where he writes that one must only act when the cause and outcome are reasonably certain. Ḥunayn also elevates humility as an ethical trait. If one has already learned the nature of every disease that he wishes to treat, the way to find out the aim in treating each one of them and the force of each symbol, one cannot ignore the principles and reasoning of the inventor of the medicine and the method he should follow in composing the medicine he needs when he finds many compound medicines of equally warranted values. This modest epistemology contrasts with the arrogance that some critics ascribe to ancient physicians and also parallels Hippocrates' own caution in prognostics, where he warns physicians not to pretend to know what they cannot predict. The intellectual contributions of the Christian Ḥunayn bin Isḥāq mark a pivotal moment in the history of science and medicine in the Islamic world. Through his extensive translations, particularly of Hellenic and Hippocratic texts, Ḥunayn not only preserved the medical wisdom of antiquity, but also prepared the way so as to be integrated it into the fabric of Islamic intellectual life. His Al-Masail fi Tibbil al-Muta'allimin, Questions on Medicine for Students, exemplifies this synthesis, offering a structured question and answer guide that weaves together scientific inquiry, ethical instruction, and pedagogical clarity. Furthermore, Ḥunayn's work contributed to the moral framework of Islamic medicine. His translations laid the epistemological foundations for Islamic medicine and shaped the development of scientific thought for centuries. His work ensured the continuity of ancient knowledge while adapting it to new cultural and religious contexts, shaping Islamic science in the 9th century and beyond. Al-Masail stands as a testament to the rich interplay between ethics and empirical science in classical Islamic civilization and underscores the enduring value of cross-cultural knowledge transmission. Thank you for your attention.
Thank you, Theodora. And thanks to our two speakers for these two presentations, which complement very well each other and also touch upon many topics that we have been discussing over these days, including the art of compounding medicine. So I guess that we'll have questions about perfume, washing hands, cross-cultural exchanges, whether for Anya there are Greek antecedents of these kind of things, for Theodora what are the continuities. Let's say there are lots of things here, and since we are using the metaphor of food, be it for the stomach or for thought, I think that we have a full menu here. So I turn the microphone to the audience. So Sean, for once, with you first.
Anya, this question is for you. Good to see you. Thanks a lot for the talk. I was wondering, because I'm always still super curious about musk, but you said at some point that musk was being used as a dentifrice or some kind of a mouth wash or something like this, right? Did I understand that correctly?
Yes, in a couple of these formulas, there's musk. It's not in all of them, primarily because if you put a lot of musk in it, it's a dark colored ingredient, and the ideal was to have a white colored compound, but some of them most definitely include musk and would have been very dark colored compounds based on the other ingredients that were in them. But there is a long association with using musk in mouth freshening compounds, believe it or not. So it's not unique to these. There are other types of perfumed compounds specifically said this is for the mouth and it's got musk in it.
Okay, so two questions about that. So I wanted to just make sure that I heard you right. So first thing is, was it musk in the sense of the product from the deer? Because I don't read the language, so I have to rely on so many things. But I've seen it in Al-Baitar and in others that there are other things that start to be called musk around, I guess, 12th century. I don't know if it's earlier. And today, right, misk, it's simply
These are earlier, and we're definitely talking about musk or something that is fraudulently or falsified and sold as musk, deer musk. Mm-hmm.
and do you know what that would taste like?
Bad, I would think.
Okay, thanks. I was thinking there's a lot of ammonia in unprocessed musk, so I'm just wondering what state of process would go on with the musk if it was processed ahead of time before it was sold, or then is it added? Because we had musk at our place, and it's very animalic and very ammonia and urine smelling, so it would be a very unpleasant thing to wash your mouth with.
Yeah. And yet the formulas think that it's great for dental care,
Okay.
for whatever reason.
Thank you.
I have a question for Anya. From all the Ḥunayn you have cited, we have a huge range of ingredients, many of which are present in the Byzantine world. And so I have been working on the plants and the medicine, but not properly on soap or this kind of product. And so my question is really a question. Have you been able to identify antecedents of this kind of formula?
I have not, and I hope that the participants of this conference may have some ideas about that. My current suspicion is that the use of Ḥunayn as conceived in these formulas may come from the Iranian culture area, but I don't know, and I'm certainly willing to find that there are such compounds.
Your presentation goes clearly in that direction with an evolution from east to west, because with Ibn al-Jazar al-Zakhawi, we move geographically, and also we have different components. And so this indeed might seem to be more specific of the Arab-Islamic world. But let's say I would be happy if we could find some sort of similar things in the Greek literature. And if you have had time to follow my presentation this morning, but it might not have been possible for you because of the time zone difference.
I saw your excellent presentation this morning. Yes.
Thank you for the compliment, by the way. Let's say, indeed, in the manuscript, I find a product of bodily hygiene, but thus far, I haven't been able, because of lack of time, to investigate that more deeply. But it would be a line of investigation for a PhD student to search about this kind of thing.
Many thanks for all these incredible talks. Thanks too much. My question is addressed again to Anya. Nice to see you again. I was wondering about the saponification process. You talk about some soluble ashes, and I was wondering if in the process, maybe I missed them, but if this process it was made under heating with different raw materials, also with the oil.
Now, one of the big questions that I have is what happened to the plant to prepare it for the use of the perfumers. I suspect that there may have been some sort of there was obviously a lot of processing that occurred to get it ready for the perfumers, but they're usually working with the material cold and combining it with these other ingredients. I think that they would have acquired the Ḥunayn in the form of a powder, we presume, and then used it to make the formulas. None of them specify combining with heat.
Thank you both. I have a question for Anya. Is that the cleansing remedy? So I might have missed that, but so that's just for hygiene, right? Okay.
Yes.
Okay.
Yes.
So it's not the same word for cleansing, or anyway, is it? Well, these are like recipes specifically for that, so it doesn't have anything to do, or the ingredients are the same for cleansing, like cleansing a wound, for example, because like in Galen, you have of the cleansing is a property, is a secondary property basically of a remedy, and it's very strong when you have a wound with a cavity, when you have like a piece of tissue missing basically, and you have the dirt that accumulates in the wound, and you need to have something cleansing, because you need to remove the dirt, otherwise the wound won't close, and basically. So I was wondering if this cleansing, if there's some similarity, or if there's anything to do with the cleansing in other, let's say, clinical contexts. Thank you.
Thank you. That's a great question. I've never seen it in any other context. It seems to be a specialized product for dining and is used on hands, faces, rubbed in the mouth. Some of the formulas describe it being used on the teeth and gums, but not for any kind of wound care or anything like that. I've never seen that.
Okay, thank you. Is the salt wort, is that eaten as well? No, as a food?
No, I don't think people ate it.
Okay.
Although you would think it might be slightly edible if it didn't. Especially if it didn't include lots of the saltwort in it. But the ones based on flour and beans and whatnot, and with perfumes in them, I would assume would be edible.
Okay, because I thought it just reminded me of this plant that we have in the lagoon, in the Vents lagoon, which is the Salicornia, which is it's kind of so it grows in salt.
It's one of these plants too. Yeah, it's in the same category. Mm-hmm.
Yeah, so I mean, I don't think it's the same overchecking, because I don't think it's actually the same genus as plant, but they're similarity with that. So I was actually wondering if there is something. Okay, thank you very much.
Yeah, the information isn't really precise enough to say what species or even genus of saltworts are involved, I think, with this.
I have a question for Theodora. You have illustrated very well the method of Ḥunayn in translating and in defining a canon for translation. There is a question. the need for these translations. And so I am thinking of the book of Dimitri Gutas, the role of translation in creating a class of administrative, a high-level administrator for the foundation of an apparatus for the state, a new state. And so my question is, can you elaborate on the question of the role of assimilation of Greek science in the formation of a society and a culture?
Yeah, thank you for your question. Yeah, actually, yeah, Professor Dimitri Gutas, in his book concerning the Greco-Arabic translation movement in Baghdad from the 8th till the 10th century onwards, set the basis for the translation from Greek works into Arabic. The translations served many things. The translation in the need of applied and theoretical knowledge. We have to investigate the motives, the Caliphs' motives for commissioning translations. Some of them wanted to have knowledge on theoretical knowledge. For example, to be able to heal illnesses, to heal the patients, and so on. Some other needs had to do with the administrative secretaries, the inheritance, the lawyers, the engineers, the economists. So then we're talking about mathematical texts to be translated. So some other texts that have been translated from Greek into Arabic actually served other purposes, like the Caliphs wanted to be able to enter into Christian-Muslim debates, to confront, for example, Al-Mahdi, the Caliph, wanted to be able to develop argumentation so as to confront the Christian Timothy I, the Patriarch. So we have to investigate the different motives, the Caliph's motives, but for the medical texts, Professor Gutas uses the text complex or complexes to classify the text. So we have a specific category under the school of Ḥunayn and his associates, where those people worked on the medical text. Ḥunayn knew Greek, so this was very good. But the interesting point concerning this specific work that I studied was the fact that my translation was based on the text of the Cairo manuscript established by Dr. Musa. But the problem with the manuscripts is a huge problem concerning this specific text. To elaborate briefly, we have some hypotheses. Two hypotheses have been proposed to explain a variation in the Arabic manuscript tradition of the questions. According to the first, expressed by Professor Fuad Sezgir, Ḥunayn authored only one text that later developed two independent forms. There is an opposite solution that was put forward by Professor Manfred Ullmann, who distinguished within the manuscript tradition of the questions two independent works. And in a later period, the opinion of Troupeau it was of paramount importance. Troupeau is said to have conclusively demonstrated that Ḥunayn penned only one treatise, and due to its active use and circulation, the text's inner literary form changed over time. So I used the critical edition of the Arabic text based on the oldest dated manuscript that was published in 1978 in Cairo, whereas an English translation based on that edition, and this was appeared in 1980 by Yanglawi. I'm not sure if I pronounce correct the name, but also we have a Latin translation of the questions and of course a Syriac text. Yeah.
By the way, there are in Greek manuscripts Q&A text, erotapokrisis, of the kind of Ḥunayn. And so that might also be a continuity with the Greek practice of making science and epistemology of science. So thanks again to the two speakers, and we'll conclude here. Thank you very much.